Hello everyone, I'm John DeShula. Welcome to Innovations in Health. I'm here with Dr. Paul Berger, and we're going to talk about the mini dental implant procedure. Dr. Paul Berger, welcome to Innovations in Health from Sonora Dentist, and you're over on Mona Way, 13945. Thanks very much for joining us. Talk to us about the mini dental implant procedure. You have some examples to show us.
Yes, the mini dental implant procedure is a form of dental implants that are placed with a lot less surgery, a lot less pain, a lot less cost, a lot less time involved, a lot less visits to the dental office, and we're excited to be able to offer it at our office. We do it all in the office. You don't have to go anywhere else. Come right to our office and we'll take care of it there.
And show us an example, because some people have said this is sort of a miraculous procedure, but it really does include so many innovative techniques. Let's start with maybe the full set of teeth or the full denture, whatever you'd like to show us first.
Yes, well, many patients do have dentures and they come to us for a stabilization process, and they complain about having to use too much of the adhesive products, and we're able to offer them a very nice solution with the mini dental implants. In a very short appointment, we can deliver, for instance, on a lower arch, we're able to place 4 mini implants, put the denture back on so that it just snaps in place, and patient can leave and eat on that appliance the same night.
That's an amazing procedure, and it happens so quickly right in your office.
Right in the office.
And show us one more time that example, because we should mention that there's the titanium. That's the actual post, if you will. If my thumb could be an example, the post is what holds the mini dental implant in place, so it doesn't move around like you were saying with those dentures that kind of move and slide. This is a solid situation.
Yes. We have many patients that describe that exactly the same way, that after they've had the unfortunate experience of the flopping denture, especially on the lower, by placing the implants on these titanium implants, we're able to get stabilization and eat on them comfortably the same day.
And it snaps right in. Show us how effective that is.
Snaps right in like
holds
that.
in place.
And holds in place. Stick your tongue out, spit, sing, chew.
All of the
it
above.
won't move.
Yeah.
Yeah.
And
it's great.
It has many applications based on your dental needs. Show us another example.
And another example, of course, is on the upper. A lot of people have a very severe gagging problem. We're able to actually place the mini dental implant on the upper arch, and we're able to literally snap that denture in. Take the palate out of the denture so that you have room for your tongue. You don't gag on it, and the denture stays put. And again, you can do everything that you need to do like you did with your natural teeth.
And that's a denture that maybe the patient already has.
That's the patient. Many patients come in and want us to take care of their denture the way that they are right now.
And you raised an interesting point, taking off that piece that really kind of impacts the taste sensation.
Yes, that's correct. You get your taste back, you got the roof of your mouth back, and you have the ability now to not gag and function just like you had your natural teeth, although you're wearing full dentures.
When someone has a full denture,
yes,
and they come in and they want to take this opportunity to get the mini dental implant procedure, what do they complain about most about the denture? What is the most ineffective thing about a denture, even though they've been around for a long time?
Well, we know that the bone begins to shrink under dentures. It's a natural process, and that the dentures begin to need more relines done on them to keep them supporting in their mouth and try to keep them stable, but they never really are stable, so they end up using an awful lot of adhesive. And this procedure allows them to be able to transfer into something where it's just a more natural process if they're going to stay with their existing denture.
But you're saying eventually that you could throw the denture out with the mini dental implant procedure.
That's correct. We now, with the technology that's available to us now with computer-guided implants, that we're able to take the available bone, and in many cases, we're able to give them a implant process where we can actually put a fixed bridge on the implants that are placed on the upper arch or the lower arch, and that can be cemented in place, and it's just like having your own natural teeth back. and no more cavities.
And it looks terrific.
And it looks great.
The teeth are made of what material, doctor?
This is a zirconia. It's the hardest material that we have in dentistry right now. And they're more durable. The shine lasts longer. They're just a great product.
And let's take a look at another example, because it could be back teeth or a single tooth that could be a situation that the patient may need.
That's correct. We have an example here, for instance, of a person that came in with 3 teeth missing, and we were able to, with our computer technology, place 3 implants, have a bridge made, and in the same day that we put the implants in about 45 minutes, we were able to give them and have them walk out of the office with that bridge.
What if a patient comes in and says, well, doc, I have some problems with my teeth, but they're in the back, nobody sees them, it's not really an issue. How would you address that with respect to the mini dental implant?
Well, the molars are the main chewing teeth, and without molars, there's more uneven pressure put on the front teeth. They begin to loosen and fall apart more quickly. And if you don't have back teeth, for instance, you couldn't hang from an airplane or pull a train with a rope with just your front teeth. You have to have the back teeth. And so using that example, many people understand they have to have molars to chew with if they're going to chew effectively and digest their food effectively.
And this is not, so as a point of discussion, not just a cosmetic procedure. This is something that will enhance the structure of the teeth in the mouth, and as a result, make your life better, because you'll be able to dig into that apple, dig into that ear of corn, eat the food that you maybe haven't been enjoying as effectively and as robustly as you have in the past. So having those back teeth are just as important as having the front teeth.
That's correct, and they will last, they'll last a long time. And
you have a single tooth example that you can show, and a personal story about one of your patients.
Yes, we had a contractor call at about 5 p.m. About 2 weeks ago, and had broken a front tooth off on the job, and was missing a front tooth, had meetings to attend and business to do. And he said, I need to come in and I can't leave without a front tooth. I said, come right in. We provided the cone beam x-ray, the necessary x-rays and exam to do the job. And we removed the shattered root, placed the implant, and the patient left the same day with a front tooth. And was very happy. It's healing now, and we'll get his permanent crown as soon as the healing is complete.
And again, that post, titanium, holds that tooth right in place, and you craft the tooth, made right here in America, to fit the mouth perfectly.
That's correct. That's correct.
And you know, it sounds like Star Trek when you talk about the imaging process. Tell us about that 3D imaging process and why it's so important in this procedure.
Well, the cone beam X-ray, 3D X-ray, is a product that's not new on the market, but it continues to develop. And I like to call it the MRI of dentistry. We're able to literally measure all the aspects of the bone in the mouth. And I use that to gauge how thick the bone is, what size of implant, what length of implant, and we're able to perfectly tailor the implant to the patient and the restoration that we're going to place.
And when we talk about bone, in the old implant procedure, I'm to understand there used to be months, if not even longer, of bone growth needed for the implant to adhere. This is different. The mini dental implant does not need as much bone, and it's something that can happen based on that imaging. You can see where that post will work.
That's correct. The old technique, the technique I've used for many years now, involved a fairly large diameter hole to be placed in the jawbone. And
we have a jawbone there, an example.
This is the jawbone, and of course when we demonstrate this, we have the hole in the jawbone. It's about the size of a pencil, and you drill that hole and you can put an implant. I have lots of them in the office right now. But that takes surgery. Many times there's some pain involved with that, and the healing takes 4 to 6 months to heal before you can take the impression for the crown and then place the crown. So it's a long process. And then we have the small, I don't know if you can see that, it's a very small hole, about the size of a pencil lead, a little bit larger and tapered, and we can place that in, and we're able to load or be able to chew on that literally the same day, soft foods the next day, pretty regular, 3 or 4 days, and you're eating normally on that implant.
And really not a painful experience.
And not a painful experience. That is probably one of the #1 comments that our patients give to us, is that they have experienced no pain, maybe a Tylenol, maybe a couple of ibuprofen, and absolutely just thrilled about the product.
I'm a patient of Dr. Paul Berger's. I just recently had a implant for 3 of my teeth, upper teeth, these here, and I had previously had a flipper, okay, and it was a very uncomfortable thing. This was all done in one day. It was a miracle. My bite is perfect. I'm just really thrilled with the outcome of my this new implant. I'm really very pleased that with Dr. Paul.
When you talk about going to the dentist, some people find it a painful experience, but it maybe is just steeped in stereotype. That's not really always the case anymore.
A lot of patients that I treat have come out of a very bad experience, and we're able to offer an experience, for instance, with conscious sedation, where a patient can take a little medication, and I can do any of these procedures while a person is comfortably resting or asleep, and they wake up, I say, "John, we're done," and they're done.
And we're done, and we're good to go. And we're talking to Dr. Paul Berger, SonoraDentist.com. That's the website, 13945 Mono Way, Sonora, California. The number, by the way, to call 209-583-3611 on innovations in health. And we're learning all about the mini dental implant procedure. And really, everybody, it can change your life and change your look. And it's an investment not only in your look, but in your health as well. Because if you're eating properly, and you're getting the right nutrition, because you can now enjoy the foods that maybe you haven't tried in the past, or things that were pureed if you really had a problem with your teeth, the mini dental implant can change your life for the better. I have to believe that people just absolutely feel better once they get this done.
Absolutely, they do.
When you, Dr. Berger, meet with your patients, and maybe they have a bit of an objection, they hear about this technique and they think it's too good to be true, how do you consult them?
Well, if it's a loose denture problem, I can't eat my food, it's painful. Every time I put my dentures in, they move, and I can't really squeeze and chew. Then we have a solution with the mini dental implant to give a patient the ability to chew with their own teeth. And if we use the fixed bridge work, it's the best of all worlds.
Doctor, when you meet with your patients and they discuss this procedure, inevitably people are going to talk about the price.
Yes.
And certainly there's a cost to the mini dental implant, but it's less expensive than the other implant procedures you discussed the old way. How do you work with a patient when it comes down to the pricing and the cost?
Fortunately, in the industry now, there's a number of financing options that we offer, and it's not just limited to one. We have actually have some no interest options also available on these implants and the crowns that go with them. So it's not as hard of a procedure, and it's not as hard to get approved as one would think.
And I think that's important to note, because if you're thinking about getting this procedure done and you're thinking about the cost, this is not something that should intimidate you. And you as a professional are going to work with that patient. And I think that's one of the reasons why people need to go and see you at Sonora Dentist, because you're going to work with them individually on what they need.
Yes.
When a patient comes in, Doc, and they want to get the mini dental implant, you do it in the office. And this is something I think is very important to tell people, because you're not going to another medical facility to have this done. Everything happens in your office, including the imaging and the actual mini dental implant.
That's correct. That's one of the things that we pride ourselves at Sonora Dentist. We have that state-of-the-art. Everything is brand new. The facility is brand new. We don't have to refer out to have the implants placed or placed properly. We're able to do it right there in the office. We have everything that's necessary to do an excellent job.
Here in the great state of California, everybody wants to look their best, in the sunshine. And this is not just a cosmetic procedure, but then there's nothing wrong with that, because if somebody has a life moment, they're looking for a new job, they're getting into a relationship, getting out of a relationship, you never know. You want to make sure that you look your best, and at the same time, it's a healthy piece as well to get the mini dental implant. But talk to me about some of the patients that have had their life enhanced by this procedure.
Well, I think one of my favorite stories comes from about an 85-year-old lady that came in tears, and she said, "I cannot eat. It's too painful, the gums hurt, the bone hurts. What can you help me with? I've heard about the mini dental implants." And so Roberta came in, and I said, "Roberta, we're able to place some implants on your existing dentures. And we may eventually make you some new dentures, but let's see what we can do for you." And in about an hour's time, we're able to place 4 of these mini dental implants in the lower denture. And Roberta went out with her denture, and we were able to snap them in place. And she was so kind, she was able to write a nice testimonial for us in the local newspaper. And I have that. I'm not sure whether we could show
Dr.
her.
Berger, we should read that testimony.
Okay.
Do you have that with you?
I do. I have that.
Dr. If you don't, I have it in front of you. And beautiful. And if you're watching, Roberta, a shout out to you, and thanks very much for giving this testimonial on the mini dental implant, because hearing it from the patient's perspective, I think really sums it up the best.
Dear Dr. Berger, I'd like to express my thanks to you and your lovely staff for making my life so enjoyable with this procedure of dental implants. It has made me so happy and given me a new lease on life. Everyone should consider doing this if they wear dentures. It's so simple. God bless you all.
Well, that's very sweet.
Yeah, I enjoyed it. And she was in last week, and I took a photo of her and I together. Those have been in for over 5 years. She's moved out of the county, but she had to come back, and she had to give me a hug before she left.
You had just shared a story that you ran into Roberta at an area restaurant.
Oh my gosh.
And you had sort of rock star treatment as a result.
Yes, it was kind of an interesting experience. I walked in and she was sitting literally across the restaurant and yelled at us, "Oh, Dr. Berger, you're here. I'm eating salad and steak and everything. And I want to introduce you to my daughter who works in an oral surgeon's office, and her husband who's an attorney, and my dear husband." And by this time, everybody in Applebee's had heard the whole story, and it was a great time.
That's great. Well, good for you. And I can see by your smile that it means something to you to make sure that these their lives are changed.
Absolutely.
For the better.
And mine too.
Yes, that's right, and yours too as a result. Let's talk about the care of the implant. How long does a mini dental implant last, and how do you care for it?
Well, we know that if you're not involved in periodontal disease and losing teeth because of loose gums and bone, that if the tooth is healthy in the bone, that it's going to hold the bone there. But if we suffer the disease processes of periodontal disease and the teeth are lost, if we have an adequate amount of bone or even a minimal amount of bone, that the mini dental implant, when placed and stabilizing these appliances, will be holding the bone and lasting longer. If you wear just the denture without the stabilization, then it's an eroding effect on the bone, and the bone can literally flatten out so that your dentures will not be stable. And so the mini dental implants recedes or stops that process of that bone loss.
And as a result, if you are wearing dentures, and you talked about how the erosion happens, you're not dealing with that goop anymore. All that
That's correct.
Awful, icky stuff. I mean, it works to some degree, and it's there for a reason. But imagine life without that. If you are right now wearing dentures and you're watching Innovations in Health thinking, maybe I should take a look at the mini dental implant, Dr. Paul Berger is who you might want to give a call. Here in the great state of California, 13945 Mono Way, Sonora, California. The number 209-583-3611. And your website is sonoradentist.com. And you have other practice. You have a dental practice and do other things in addition to mini dental implants.
Yes, we're a full-service facility. We treat all ages and welcome all families and do all phases of dentistry. We refer very little out. You don't have to go to a lot of different facilities in Sonora or anywhere else if you want to stay and have it done in one place.
Let's go back to the care question because we talked so much about the goop there a little bit ago. But I'm to understand a water pick and good dental hygiene is what you would need to keep the mini dental implant clean and the denture and how it's all fixed.
Yes, so that's a question that comes up often when we're considering going to the fixed dental implants with the bridge work and cement it in place. What do I do to manage the cleaning? The beauty of this technique, since it's a computer guided technique is that when the appliance is made, let's take for instance the full cemented roundhouse bridge, we call it, the underneath side perfectly adapts to your gums so that there's not all of this food and food products that are going to migrate underneath of this. You have your teeth cleaned every 6 months, get everything polished up. We're able to, we issue a free water pick, we call it the hydro flosser, and an electric toothbrush. And we're able to clean these appliances very well, and just the normal daily care that you would have with your own teeth.
And I think people should know that, good oral health care leads to good overall care. So many things can be traced, to the mouth, heart disease even, so many things that, that people don't understand. So why do you think, Doc, there is that apprehension sometimes to take care of the teeth? It's okay. It's an investment in your health.
Yes, and maybe it comes out of a lot of life experiences that we bring, my age group and some younger, some older. Dentistry was a horrible experience, and by offering sedation dentistry and that kind of care, a gentle technique, a thorough technique, and knowing that you're in good hands and professional hands, that you're going to have a great result. And so we have a number of patients that won't come to the dental office without some additional help.
We've talked about dentures and some of the patients perhaps being a little bit older, but the mini dental implant can happen if you're a younger person as well. It could be, as you mentioned, with that individual had a tooth knocked out, or if it's a sports injury.
That's correct.
Somebody that has some other dental issue. So the age of the patient could range anywhere. It doesn't have to be a senior.
That's correct. Yeah, it's available for all ages. You can use this on a teenager that is missing congenital front teeth. You can do it in the middle of orthodontic treatment. We've done all phases of that and been able to place teeth to complete the smile and complete the chewing apparatus and give them a great result.
And you have a very famous patient, I understand, a prominent citizen of Sonora. Talk to us about that individual.
Well, he's a public official hired by the county and brings economic development to the county, and came in with a need. He brought an inadequate upper denture, and he had some failing teeth, and he had a similar experience which I can relate to very well, where dentistry was just not generally an option. We just couldn't do it. And so we talked about the whole procedure, and he was comfortable with it. The greatest thing is that if he could replace that upper denture and have something cemented in just like they were his own teeth on his own roots, that he would want that done. And this has happened only over the last 6 to 8 weeks. And everything's been planned and processed. He's had the appliances placed, and he was kind and gracious enough to offer an interview for us, and so we have that also available.
Well, let's take a look and find out about the great work from Dr. Paul Berger.
I am Dr. Paul Berger's patient. I've recently been transitioning from dentures, which I've had for about 15 years. I really wanted something that was more of a permanent fix and something that I can enjoy for the rest of my life. I got my implants put in last Thursday. This is now Wednesday. I've actually been able to work from home most of the time and been able to fully function. They were able to do sedation here on site and were able to allow me to go through the entire process pain-free. Overall, I've been very, very happy with the whole process, and my wife also has been very happy. She sees that I am enjoying my smile a lot more than what I did even when I had my dentures.
Well, Dr. Berger, that's terrific. You had a testimonial there from one of your top patients. That's a great testimony to you.
Yes, it's great. He's a terrific individual and very kind and gracious.
And Sonora Dentist is where you can find Dr. Paul Berger at 13945 Mono Way. Sonora, California. The number is 209-583-3611. SonoraDentist.com. So if you're watching and if by now haven't been convinced that the mini dental implant procedure is for you, show us again, doctor, if somebody's just kind of tuning in late, how the mini dental implant works and how it can put those teeth in place.
Well, we're able to stabilize the lower denture if you have your own dentures and want something that just fits a little tighter. We're able to place those in the office, usually inside of a day, and you can walk out with stable dentures, upper and lower. We're able to take emergencies, which we do routinely. In an accident and you need a front tooth or any tooth replaced, most of the time we're able to place that implant and a temporary crown on that situation. If you're missing teeth and you're wearing a floppy old partial that just falls out all the time, loose and old, and you want something to be replaced, we're able to simply take that partial out, put in the mini dental implant into the space where your teeth are or were, and on the same day I'm able to put that bridge and cement it in place, kiss that partial goodbye. You're never going to need it again. You got your own teeth in place.
And more than anything, we want to throw those dentures out, don't we?
Throw those dentures out. If you want something cemented in place, I'm able to make you a bridge, put them on mini dental implants in your upper jawbone or lower jawbone, and they're cemented in place. You can eat, spit, sing, chew, and come back and have your teeth cleaned every 6 months, just like normal teeth, and beautiful, beautiful cosmetic results. And if you just need it for cosmetic reasons, it's a beautiful way to have the cosmetic dentistry done at a fraction of the cost.
Fraction of the cost, that's right. We should mention less invasive, less discomfort, less healing time, less visits to the dentist. Not that we don't want to see you, Dr. Berger, and your great team at Sonora Dentist, but it's less expensive. How long have you been a dentist?
I've been a dentist for 47 years.
Did you ever think when you started that you would see a technique as revolutionary as this?
No, and I've been through all phases of implants since 1972. So for 45 years, I've been placing just about every imaginable type of implant in patients' mouth, upper and lower. And this is by far the least painful. There's no surgery. It's like, it's literally the difference between night and day when it comes to putting in implants. And patients functioning with these the same day or the day after has just never been possible before this procedure.
And this is a procedure, I know you go across country from here in California all the way to Buffalo, New York to learn some of the latest mini dental implant techniques. A less invasive technique, and you can go right there and find out how you can get this done in the office in one day.
That's correct.
All right.
Yeah, it's amazing.
Dr. Paul Berger, thank you very much for joining us on Innovations in Health. Continued success to you and all of your patients, and keep everybody smiling here in the great state of California.
Thank you so much.
Thank you very much, Doctor.